Good afternoon, everyone. First of all, let me introduce myself. My name is Chen Su. I come from the Department of Thoracic Surgery, Fujian Provincial Hospital, and you can call me Chen Laoshi or Professor Chen. And it's my pleasure to study this lesson with you. According to the school schedule, today our topic is acute pulmonary failure in surgical patients. Sometimes we also call it as acute lung injury. And today, our content will be divided into the following sections: definition, causes, pathophysiology, clinical features, diagnosis, and treatment. And the contents that need to grasp particularly include the causes and the treatment. The first part is definition. Imaging plays an important role in the diagnosis of acute lung injury. Clinically, the most commonly used imaging tests include X-ray and computed tomography, and we also call it CT. And first, let's take a look at these two groups of imagery from two different patients. And in the left, this group is come from a normal patient, and in the right, the two pictures is from a patient with acute lung injury. And from the pictures, we can see no pleural effusion or pneumothorax in a normal person, and the diaphragm and the mediastinal is clear in a normal person. While in the patient with acute lung injury, the chest X-ray and the CT demonstrated diffuse and extensive bilateral interstitial and alveolar infiltrators. So, with the first impression of acute lung injury, let's take a closer look at its definition. Generally speaking, respiratory failure due to cardiogenic factors is beyond our scope of discussion, and acute lung injury, we also call acute pulmonary failure, and it's a clinical syndrome consisting of pulmonary capillary endothelial and alveolar epithelial injury, increased vascular permeability. Just as I have mentioned before, in most cases, it's caused by non-cardiac factors. Clinically, patients usually present with acute, progressive dyspnea, and with the development of primary disease, the symptoms get worse. The symptoms cannot be relieved by oxygen alone. If not treated promptly and effectively, it will eventually develop to refractory hypoxemia and pulmonary edema. Then the second part is causes, which is an important part in this section. Acute lung injury can be caused by the following factors, including acute respiratory distress syndrome, we also call ARDS, and mechanical failure, atelectasis, aspiration, pulmonary contusion, pneumonia, pulmonary embolism, cardiogenic pulmonary edema, and neurogenic pulmonary edema. Now, first of all, let's see the ARDS. ARDS is the abbreviation of acute respiratory distress syndrome, and the chest X-ray or CT often shows a diffuse infiltrator. The specific performance is as follows: chest X-ray showed severe exudation of the lung, blood hidden, and costophrenic injury. Chest CT further reveal diffuse exudation and interstitial inflammation in both lungs. And ARDS